Good morning to each and everyone. We are the Group 4 and we are here to discuss worksheet number 4, Cardiovascular and Lymphatic System. And to start the discussion, let me call on Miss Monica.
Good day, everyone. My name is Monica Guinocor, and I will be reporting this stepping in part 1, which is the blood. Composition of blood. For number 1 question, what is the blood volume of an average size adult? Our answer is 5.5 liters. For number 2, what determines whether blood is bright red or a dull brick red? Our answer is the amount of oxygen it is carrying. Oxygen-rich blood is bright red. Therefore, without oxygen connected, blood is a darker red color. For number 3, use the key to identify the cell type or types of blood elements that fit the following descriptive elements. Some terms may be used more than once. The key cell types or blood elements are the basophil, eosinophil, erythrocyte, formed elements, lymphocyte, megakaryocyte, monocyte, neutrophil, and plasma. For number 1 question, its name means neutral loving, a phagocyte. Our answer is neutrophil. Number 2, granulocytes. Our answers are neutrophil, eosinophil, and basophil. For number 3, also called a red blood cell. Our answer is erythrocyte. Number 4, agranulocytes. Our answers are lymphocytes and monocytes. Number 5, ancestral cell of platelets. Our answer is megakaryocyte. For number 6, basophils, eosinophils, erythrocytes, lymphocytes, megakaryocytes, monocytes, and neutrophils are all examples of these. Our answer is formed elements. Number 7, number rises during parasite infections. Our answer is eosinophil. Number 8, releases a vasodilator, the least abundant WBC or white blood cells. Our answer is basophil. For number 9, transports oxygen. Our answer is erythrocyte. Number 10, primarily water, non-cellular, the fluid matrix of blood. Our answer is plasma. Number 11, phagocyte in chronic infections. Our answer is monocyte. For number 12, the 5 types of white blood cells. Our answers are neutrophil, eosinophil, basophil, lymphocyte, and monocyte. In question number 4, list 4 classes of nutrients normally found in plasma. Our answers are amino acids, glucose, fatty acids, and vitamins. Name 2 gases. The 2 gases are the carbon dioxide and oxygen. Name 3 electrolytes. The 3 electrolytes are the sodium, potassium, and calcium. Number 5. Describe the consistency and color of the plasma you observed in the laboratory. Our observations are it was viscous and sticky, straw colored or light yellow in color. For number 6, what is the average lifespan of a red blood cell? How does its enucleate condition affects this lifespan? Our answer is 100 to 120 days. When the RBC's ATP reserves have been exhausted, the membrane begins to fragment. Without DNA to direct mRNA synthesis, needed enzymes cannot be made. Number 7. From memory, describe the structural characteristics of each of the following blood cell types as accurately as possible and note the percentage of each in an individual's total population of white blood cells. For eosinophils, it is a large and red stained cytoplasmic granules. It is 1 to 4% of white blood cells. For neutrophils, pale pink cytoplasm fine granules. Nucleus is multilobed in stains and purple deep purple. 40 to 70% of white blood cells. For lymphocytes, a small cell with a spar pale blue cytoplasm and dark purple staining spherical nucleus, up to 20 to 45% of WBC or white blood cells. For basophils, sparse dark blue cytoplasmic granules that may obscure the large U-shaped nucleus, which stains dark blue, and up to 0.5% or less of WBC or white blood cells. For monocytes, abundant gray blue cytoplasm, dark blue purple nucleus, often kidney shaped, 4 to 8% of WBC or white blood cells.
Good day everyone, I am Victorian Gapasin and I am here to discuss my answers on the group worksheet. Correctly identify the blood pathologies described in column A by matching them with selections from column B. Number 1. Abnormal increase in the number of white blood cells. The answer is leukocytosis. Number 2. Abnormal increase in the number of red blood cells. The answer is polycythemia. Number 3. It is the condition of too few red blood cells or of red blood cells with hemoglobin deficiencies. The answer is anemia. Number 4. Abnormal decrease in the number of white blood cells. The answer is leukopenia. Hematologic test. Broadly speaking, why are the hematologic studies of blood so important in diagnosis disease? My answer is changes of characteristics in blood may state some certain disease. White blood cells, red blood cells, and platelet count are important because it can specify disease if there is a lacking or there's too much of it. A disease can also be discovered depending on the physical looks of the blood. The next item that I will discuss is the chart. In the chart that follows, record information from the blood test you conducted. Complete the chart by recording values for healthy male adults and indicating the significance of high or low values for each test. Since we don't have student test results, we're just gonna leave that off. First, total white blood cells count. The normal values for healthy male adults is 5,000 to 10,000 per microliter of blood. Its high value is above 11,000 cells per microliter of blood, and the low values is less than 4,000 cells per microliter of blood. Next is the total red blood cell count. The normal values in healthy male adults is 4.7 to 6.1 million cells per microliter, and the high values is any count higher than 6.1 million red blood cells, and the low value is less than 13.5 gram per 100 microliter. Next is the hematocrit. The normal value for healthy male adults is 41 to 50%, and the high value is anything higher than 54%. The low value is less than 41%. Hemoglobin determination for normal and healthy male adults is 14 to 18 grams per deciliter. The high value is any value greater than 8.5 grams per deciliter, and the low value is less than 13.5 grams of hemoglobin per deciliter. The coagulation time for normal healthy male adults is 2 to 8 minutes, and the high value is any numerical value above 8 minutes. And the low value is any numerical value less than 2 minutes. Define hematocrit. Hematocrit helps determine the proportion of red blood cells in the person's blood. Number 12. If you had a high hematocrit, would you expect your hemoglobin determination to be low? It would be high. Why? It is because of the relationship of red blood cell volume and hemoglobin determination. High red blood cell volume also comes with high hemoglobin determination. Number 13. If your blood clumped with both anti-A and anti-B sera, your ABO blood type would be blood type AB. To what ABO blood groups could you give blood? You could only give blood to only AB blood type. From which ABO donor types could you receive blood? You could receive blood from blood type A, B, AB, and O. Which ABO blood type is the most common? The most common blood type is O, and the least common is blood type AB. Next is the number 14. Explain why an Rh negative person does not have a transfusion reaction on the first exposure to Rh positive blood, but does have a reaction on the second exposure. His blood has no anti-Rh bodies that have already been produced. When the immune system is exposed to Rh positive blood for the first time, it reacts by producing antibodies. What happens when an ABO blood is mismatched for the first time? Antibodies clump together, causing the blood to stop working properly. And on the item number 15, assume that the blood of two patients has been typed for ABO blood type. On the basis of these results, Mr. Adams has type O blood, and Mr. Calhoun has type A blood. Could Mr. Adams safely receive a blood transfusion from Mr. Calhoun? The answer would be yes. Could Mr. Calhoun safely receive a blood transfusion from Mr. Adams? The answer would be no. That's all. Thank you.
Good day, ma'am. Good day, classmate. I am Jackie Gato, and I will be the one who will present our answers for the part 2 of the stepping in, which is the anatomy of the heart. First is the gross anatomy of the human heart. Number 1, this is the anterior view of the heart, and first I will present our answer from the right side. From the right lines, from upper to lower, before I proceed to the left lines. So for the first line in the right side, our answer is brachiocephalic trunk. It is an artery of the mediastinum that supplies blood to the right arm, the head, and neck. The second one is the superior vena cava. It carries blood from the head, neck, arms, and chest. The third one is the right pulmonary artery, which carries blood from the right side of the heart to the lungs. The fourth one is the ascending aorta. It is the upper part of the arch, which is the section closest to the heart. The fifth one is the pulmonary trunk. It is a vessel that emerges from the heart. The sixth one is the right pulmonary veins. It refers In refers to the heart, the right pulmonary veins pass behind the right atrium and superior vena cava return. For the seven one is the right coronary artery in the coronary sulcus, or the right anteroventricular groove. It supplies blood to the right ventricle and the right atrium. So for the eighth one, which is the right ventricle, it passes the blood on the right artery, which send it to the lungs to pick up oxygen. And it solely pumps blood to the lungs. And for the last line in the right side, our answer is inferior vena cava, which carries blood from the leg, feet, and organ in the abdomen and pelvis. Now let's proceed to our answers in the left lines. So for the answer for the first line is the common carotid artery, which provide the main blood supply to the head and neck. The second one is left subclavian artery. It supplies blood to the left arm. And for the third one, which is the aortic arch, it is the segment of the aorta that helps to distribute blood to the head and upper extremities. For the fourth one, which is the ligamentum arteriosum, it is a fibrous remnant of the fetal ductus anteriosus. The fifth one is the left pulmonary artery. It sends blood to the left lungs. For the sixth one is the left pulmonary veins. It passed in front of the descending thoracic aorta and carries oxygenated blood. For the seventh one, which is the left atrium, it receives blood full of oxygen from the lungs and then empties the blood into the left ventricle. For the eighth one, which is the left coronary artery in coronary sulcus, or the left anteroventricular groove, it originates in posterior to the pulmonary trunk and travels inferiorly, separating the left atrium and left ventricle. And for the second to the last line, which is the left ventricle, it pumps the oxygen-rich blood through the aortic valve out to the rest of the body. And for the last one, which is the apex, it is the inferior tip of the heart and the points toward to the left side. Number 2, the question is, what is the function of the fluid that fills the pericardial sac? Our answer is the fluid acts as a lubricant for the heart's movement, reducing friction as it pumps blood and allowing the heart to beat in a relatively frictionless environment. For number 3, it contains 9 items. So for number 1, drains blood into the right atrium, our answer is coronary sinus. For number 2, superior heart chambers, our answer is arteria. For number 3, inferior heart chambers, our answer is ventricles. For number 4, vesicular pericardium, our answer is epicardium. For number 5, receiving chambers of the heart, our answer is arteria. For number 6, layer composed of cardiac muscle, our answer is myocardium. For number 7, provide nutrient blood to the heart muscle, our answer is coronary arteries. For number 8, lining of heart chambers, our answer is endocardium. And for the last one, which is the number 9, actual pumps of the heart, our answer is ventricles. Number 4, the question is, what is the function of the valves found in the heart? Our answer is the heart valves allow blood to pass through the heart in one direction, and it also preventing the blood to backflow. For number 5, the question is, can heart function with leaky valves? Our answer is yes. The heart can function with leaky valves. However, it can make the heart work harder and cause it to pump less blood that may lead to some serious condition like heart failure, atrial fibrillation or irregular heartbeat, or pulmonary hypertension. Number 6, the question is, what is the role of the chordae tendineae? Our answer is, chordae tendineae are tough connective tissue strands that keep the valves in place. For number 7, a simple schematic of so-called general circulation is shown below. What part of circulation is missing from this diagram? Our answer is the pulmonary circulation, or the circulation to the lungs from the right heart. Correctly draw the diagram as best you can to make it depict a complete systemic or pulmonary circulation and rename the general circulation as the correct subcirculation. So this is our answers. So first one is the pulmonary circulation. First is the pulmonary arteries going to the pulmonary capillaries, go to the pulmonary veins, go to the heart and back to the pulmonary arteries. The next one is the systemic circulation. First is the systemic arteries to the systemic capillaries, to the systemic veins, to the heart, and back to the systemic arteries. For number 8, differentiate clearly between the roles of the pulmonary and the systemic circulation. Our answer is the pulmonary circuit takes all incoming blood from the body and sends it to the lungs, while the systemic circulation provides fictional blood supply to all body tissue. For number 9, it consists of 13 items. So our first answer is right ventricle. Second is pulmonary semilunar. Third is pulmonary arteries. Fourth is the pulmonary veins. Fifth is the left atrium. Sixth is the bicuspid or the mitral. 7 is the left ventricle. 8 is the aortic semilunar. 9 is the aorta. 10 is the capillary beds. 11 is the superior vena cava. 12 is inferior vena cava, and the last one is the coronary sinus. For number 10, the question is, if the left atrioventricular valve does not close properly, which circulation is affected? Our answer is pulmonary circulation. For number 11, the question is, why might a thrombus or blood clot in the anterior descending branch of the left coronary arteries cause sudden death? Our answer is, it can cut off the blood supply to the heart, resulting in a rapid sudden death. For the next part of the anatomy of the heart is the microscopic anatomy of cardiac muscle. Number 12, add the following terms to the photos of the cardiac muscles at the right. So our answers is, for the first line, is the intergalactic disc. For second line, our answer is nucleus cardiac muscle fiber. For the third line, our answer is striation. And for the last one, which is the fourth line, our answer is cardiac muscle fiber. For the last item of the anatomy of the heart, which is the number 13, the question is, what role does the unique structure of cardiac muscle play in its function? Note, before attempting a response, describe the unique anatomy. Our answer is, one of the unique features of cardiac muscle is the intergalactic disc. This intergalactic disc contains two-part structures that are important in cardiac muscle contraction, the gap junction and the desmosomes. This enables the muscle cells to synchronize during the contraction. It also allows an electrical connection between cells, which is vital to the function of the heart as a whole. So that's all for the anatomy of the heart. For the next part, which is the anatomy of the blood vessels, Miss Japay will further discuss it. Thank you.
Good day, everyone. I am Zonkais Japay and I will be the reporter for Test 3 Anatomy of the Blood Vessels, number 1 to 5. Item number 1 Key Terms: Tunica intima, tunica media, and tunica externa. Number 1 Tunica intima, most internal tunic. Number 2 Tunica media, bulky middle tunic, contains smooth muscle and elastin. 3. Tunica intima. Its smooth surface decreases friction. Number 4. Tunica intima. Tunic of capillaries. Number 5. Tunica intima, tunica media, tunica externa. Tunics of arteries and veins. 6. Tunica media. Tunic that is especially thick in arteries. 7. Tunica externa. Most superficial tunic. Let's proceed to item number 2. Servicing the capillaries is the basic function of the organs of the circulatory system. Explain this statement. Our explanation was, only the capillaries directly serve the needs of the body cells. It is through the capillary walls that exchanges are made between tissue cells and blood. Respiratory gases, nutrients, and wastes move along diffusion gradients. Item number 3. Which of these vessels may have valves? Answer: veins. Which of these vessels depends on its elasticity to propel blood along? Our answer: artery. Which depends on the skeletal muscle pumped and changes during breathing? Our answer: veins. As muscle contract and release, the blood is milked through the veins towards the heart. Pressure changes that occur in the thorax during breathing also aid blood return. Let's proceed to item 4. Why are the walls of arteries relatively thicker than those of the corresponding veins? Our explanation was, arteries and veins experience different pressure of blood flow. Arteries experience a pressure wave as blood is pumped from the heart. This can be felt as a pulse. Because of this high pressure, the walls of the arteries are much thicker than those on veins. Lastly, item number 5. The arterial system has one of these. The venous system has two. Our answer for number 1, brachiocephalic. Item 2. These arteries supply the myocardium. Answer: coronary. Number 3. The more anterior artery pair serving the brain. Answer: internal carotid. 4. Longest vein in the body. Answer: great saphenous. 5. Artery on the foot checked after leg surgery. Dorsalis pedis. 6. Serves the posterior thigh. Answer: deep artery of thigh. 7. Arteries supplying the diaphragm. Answer: phrenic. 8. Formed by the union of the radial and ulnar veins. Answer: brachial. 9. Two superficial veins of the arm? Answer, cephalic and basilic. 10. Artery serving the kidney. Answer, renal. 11. Testicular or ovarian veins. Answer, gonadal. 12. Artery that supplies the distal half of the large intestine. Answer, inferior mesenteric. 13. Drains the pelvic organs and lower limbs. Internal iliac. 14. What the external iliac vein drains into in the pelvis. Answer, femoral. 15. Major artery serving the arm. Answer, brachial. 16. Supplies most of the small intestine. Answer, superior mesenteric. 17. What the femoral artery becomes at the knee. Answer, popliteal. 18. An anterior trunk that has three major branches, which run to the liver, spleen, and stomach. Answer, celiac trunk. 19. Major artery serving the skin and scalp of the head. Answer, external carotid. 20. Two veins that join, forming the popliteal vein. Answer, anterior tibial and posterior tibial. 21. Artery generally used to take the pulse of the wrist. Answer, radial. Now let's proceed to the next reporter.
Once again, I am Athesa Gonzaga and I'm going to tackle the different arteries and veins of a human body. So what are arteries? Basically, arteries are the blood vessels that deliver oxygen-rich blood from the heart to the tissues of the body. The arteries are as follows: internal carotid artery, external carotid artery, vertebral artery, brachiocephalic trunk, axillary artery, ascending aorta, brachial artery, superior mesenteric artery, conadal artery, inferior mesenteric artery, common iliac artery, external iliac artery, femoral artery, popliteal artery, anterior tibial artery, posterior tibial artery, dorsalis pedis artery, arcuate artery, common carotid artery, subclavian artery, aortic arch, celiac trunk, specifically left gastric artery, thoracic aorta, renal artery, radial artery, ulnar artery, internal iliac artery, and lastly, the deep artery of thigh. Veins are blood vessels that carry blood low in oxygen from the body back to the heart for reoxygenation. The veins of a human body are as follows: external jugular vein, vertebral vein, internal jugular vein, superior vena cava, axillary vein, hepatic vein, hepatic portal vein, superior mesenteric vein, inferior vena cava, ulnar vein, radial vein, common iliac vein, external iliac vein, femoral vein, popliteal vein, anterior tibial vein, fibular vein, dorsal venous arc, subclavian vein, right and left, basilic vein, splenic vein, median cubital vein, renal vein, and inferior mesenteric vein. I am Athesa Gonzaga and I'm going to tackle the blood flow for the following situations. For the first situation, it is the blood flow from the capillary beds of the left thumb to the capillary beds of the right thumb are as follows: digital vein, L radial vein, L brachial vein, L axillary vein, L subclavian vein, L. brachycephalic vein, superior vena cava, R. atrium, R. ventricle, pulmonary trunk, pulmonary artery, lobar artery, pulmonary capillaries of the lung, pulmonary veins, L. atrium, L. ventricle, aortic arc, brachycephalic artery, R. subclavian artery, R. axillary artery, R. brachial artery, R. radial artery, and digital artery. For the second situation, it is the blood flow from the pulmonary vein to the pulmonary artery by way of the right side of the brain. There are two pathways. The first pathway, or the major pathway, has 80% of the cerebral tissue, and the second pathway supplies occipital lobe and part of temporal lobe. Our answer is two pathways. First, major pathway serves over 80% of cerebral tissue, pulmonary vein, L. atrium, L. ventricle, aortic arc, brachycephalic trunk, R. common carotid artery, R. internal carotid artery, R. medial cerebral and right anterior cerebral arteries, capillary beds, dural sinuses, internal jugular vein, brachycephalic vein, superior vena cava, R. atrium, R. ventricle, pulmonary trunk, and pulmonary artery. For the second pathway, it supplies occipital lobe and part of temporal lobe, follows path 1 until brachycephalic artery, then R. subclavian artery, R. vertebral artery, basilar artery, R. posterior cerebral artery, capillary beds, and the third route same as path 1.
So, good day everyone. My name is Eliza Andrea Fronteras, and I'll be the one to report this special circulation. So, in pulmonary circulation, number 8, trace the pathway of a carbon dioxide gas molecule in the blood from the inferior vena cava until it leaves the bloodstream. So, the first is in inferior vena cava. The first is right atrium. Next is right ventricle. Next, pulmonary trunk. Next, right or left pulmonary artery. Next is lobar artery. Next is pulmonary capillary beds in lungs. And next is air sacs of lungs. In number 9, trace the pathway of an oxygen gas molecule from an alveolus of the lung to the right atrium of the heart. So in alveolus right atrium, first one is the alveolar capillary walls, passes through the pulmonary vein, through the left atrium, through the left ventricle, to aorta, to systematic arteries, to capillary beds of tissues, to systemic veins, to superior or inferior vena cava. Number 10. Most arteries of the adult body carry oxygen-rich blood, and the veins carry oxygen-depleted carbon dioxide-rich blood. So how are the pulmonary arteries and veins different? The pulmonary arteries carry oxygen-poor blood to the lungs, whereas the pulmonary veins carry oxygen-rich blood from the lungs to the left heart. In hepatic portal circulation, number 11, what is the source of a blood in the hepatic portal system? So the answer is the hepatic portal vein and hepatic arteries. Number 12, why is this blood carried to the liver before it enters the systematic circulation? Because it contains all of the products of digestion absorbed from the GI tract. So all useful and non-useful products are processed in the liver before being either released back into the hepatic veins, which joins the inferior cava just inferior to the diaphragm or stored in the liver for later use. Number 13. So the hepatic portal vein is formed by the union of splenic vein, which drains the spleen, pancreas, greater curvature of the stomach, and the superior mesenteric vein, which drains the small intestine and ascending colon. The gastric vein, which drains the lesser curvature of the stomach, empties into the hepatic portal vein. Number 14. Trace the flow of a drop blood from the small intestine to the right atrium of the heart, noting all structures it encounters or passes through on the way. So the first one is the capillaries of small intestine to superior mesenteric vein to hepatic portal vein, liver sinusoids to hepatic vein to inferior vena cava. So in arterial supply of the brain, branches of the internal carotid and vertebral arteries cooperate to form a ring of blood vessels encircling the pituitary gland at the base of the brain. What name is given to this communication network? So the answer is circle of Willis. So what it is function? It provides alternate pathways for blood to reach brain tissue in the case of impaired blood flow in this system. Number 16. What portion of the brain is served by the anterior and middle cerebral arteries? The answer is cerebrum. Number 17. Trace the usual pathway of a drop of blood from the aorta to the left occipital lobe of the brain, noting all structure through which it flows. First is the aorta to subclavian artery, to vertebral artery, to basilar artery, to vesperial central cerebral artery, to aorta, to subclavian artery, to vertebral artery, to posterior cerebral artery, to left occipital lobe. So in fetal circulation, the failure of two of the fetal bypass structures to become obliterated after birth can use congenital heart disease, in which the youngster would have improperly oxygenated blood. Which two structures are this? So the answer is ductus arteriosus and foramen ovale. So in number 19, so structure umbilical artery. So the function in fetus is carries newly oxygenated and nutrient-rich blood back to the fetus in and that is umbilical vein. So in umbilical artery carries the oxygenated blood from fetal circulation to the placenta. So in ductus venosus allows oxygenated blood in the umbilical vein to bypass the liver and is essential for normal fetal circulation. In ductus arteriosus sends oxygen-poor blood to the organs in the lower half of the fetal body. So number 20, what organ serves as a respiratory, digestive, excretory organ for the fetus? So the answer is placenta.
Good day everyone, I am Tanya Garcia and I'm going to discuss our answers in human cardiovascular physiology, blood pressure, and pulse determination cardiac cycle. For number 1, using the terms to the right of the diagram and the letter choices on the diagram, Correctly identify each valve closing and opening, chamber pressure, volume lines, heart sounds, and each period of the cardiac cycle. Number 1, aortic pressure, answer I. Number 2, atrial pressure, left, answer K. Number 3, ECG, answer N. Number 4, first heart sound, answer O. Number 5, second heart sound, answer is P. 6, ventricular pressure left, answer G. C, ventricular volume, answer M. 8, aortic valve closes, answer is H. Number 9, aortic semilunar valves opens, answer F. 10, AB and semilunar valves are closed, answer A and E. 11, AB valve closes, answer J. 12, AB valve opens, answer L. 13, ventricular diastole, answer F and G. 14, ventricular systole, answer F. For number 2, define the following terms: systole, diastole, cardiac cycle. Systole, contraction of the ventricles; diastole, ventricular relaxation; and cardiac cycle, 1 complete heartbeat including atrial and ventricular contraction. Number 3, answer the following questions concerning events of a cardiac cycle. When are the AB valves closed? During ventricular systole. Open during atrial contraction and ventricular diastole. What event within the heart causes the AB valves to open? As pressure builds up in the ventricles during systole, the AB valves open and allow blood to leave the heart. What causes them to close? As ventricular systole starts, the AB valves close. When are the semilunar valves closed? During the period of relaxation of the heart as a whole and during atrial contraction. Open during ventricular systole. What event causes the semilunar valves to open? The pressure from the atrial contraction open the semilunar valves. To close, as ventricular systole start, the AB valves are closed and the semilunar close. At what point the cardiac cycle is the pressure in the heart highest? Answer, ventricular systole. Lowest, ventricular diastole. Number 4, if an individual heart rate is 80 beats minutes, what is the length of a cardiac cycle? Our answer is 0.75 seconds. For number 5, complete the following statement. The monosyllables describing the heart sounds are blank and blank. The first heart sound is a result of closure of the blank and blank valves, whereas the second is a result of closure of the blank and blank valves. The heart chambers that have just been filled with you. Here the first heart sounds are the blank, and the chambers that have just emptied are blank and blank. Immediately after the second heart sound, the blank and blank are filled with blood, and the blank and blank are empty. Number 1, our answer is lob and dub. Number 2, bicuspid and tricuspid. Number 3, aortic and pulmonary. Number 4, left ventricle and right ventricle. Number 5, left atrium and right atrium. 6, left atrium and right atrium. 7, left ventricle and right ventricle. Number 6, as you listen to the heart sounds during the laboratory session, what difference in pitch, length, and amplitude or loudness of the two sounds did you observe? Our answer is first heart sound is longer, louder, and lower in pitch than the second heart sound, which is short, sharp, and high pitch. For number 7, the question is, no one expects you to be a full-fledged physician on such short notice. But on basis of what you have learned about heart sounds, how might abnormal sounds be used to diagnose heart problems? Our answer is abnormal sounds such as swishing sounds after valvular closure or high-pitched sounds arising when blood is forced through constricted opening might indicate valvular problems. For number 8, define pulse. Indirect measure of the contraction of the left ventricle of the heart, measure rate at which the heart is beating. Number 9, identify the artery palpated at each of the following pressure points: at the wrist, radial; in front of the ear, temporal; in the groin, femoral artery; on the dorsum of the foot, dorsalis pedis; at the side of the neck, carotid; above the medial malleolus, posterior tibial artery. Number 10. How would you tell by a simple observation whether bleeding is arterial or venous? Our answer is if it sports, it is arterial. It will flow evenly if it is venous blood. For number 11, define blood pressure. Our answer is pressure exerted by blood against the wall of the blood vessels. 12. Identify the pace of the cardiac cycle to which of the following apply: systolic pressure, systole, ventricular contraction; diastolic pressure, diastole or relaxation. Number 13, what is the name of the instrument used to compress the artery and record pressure in the auscultatory method of determining blood pressure? Our answer is sphygmomanometer. Number 14, what are the sounds of corot cough? Our answer is sounds that can be auscultated over a partially occluded artery. What causes the systolic sounds? Our answer is sounds of the turbulent blood flow as it first begins to move through the constricted artery. The disappearance of blood. Blood is flowing freely. The artery is no longer constricted. Interpret 145 over 85. 145 is equal to systolic pressure. 85 is equal to diastolic pressure reported as the point where the sounds muffles. Sounds never disappeared. 16. In exercise 21, you learned about the relative position of veins and arteries. Based on this knowledge, how would you expect venous pressure to compare to arterial pressure? Our answer is venous pressure are lower. Why? The veins are further removed from the pumping action of the heart. Number 17. What effect do the following have on blood pressure? Indicate increase by I and decrease by D. Number 1. Increase diameter of the arterioles. Answer is D. Number 2. Increase blood viscosity. Answer is I. Number 3. Increase cardiac output. Answer is I. Number 4. Hemorrhage. Answer is D. Number 5. Arteries sclerosis. Answer is I. 6. Increase pulse rate. Answer is I. 18. In which position, sitting, reclining, or standing, is the blood pressure normally the highest? Answer is standing. The lowest, reclining. What immediate changes blood pressure did you observe when the subject stood after having been in the sitting or reclining position? Answer, it decreased initially and then increased. What changes in the blood vessels might account for the change? Upon standing, gravitational pull caused blood pressure pulling in the lower part of the body, but then vasoconstriction initiated by vasomotor center caused blood pressure to rise. After the subject stood for 3 minutes, what changes in blood pressure did you observe? Systolic pressure went down, systolic pressure stayed higher. How do you account for these changes? Decreased activity of the sympathetic nervous system. Number 19. What was the effect of exercise on the blood pressure? Answer is increased blood pressure. On pulse, increased pulse. Do you think these effects reflect changes in cardiac output or in peripheral resistance? Answer is cardiac output. Number 20. Describe normal skin color and the appearance of the veins in the subject forearm before any testing was conducted. Our answer is skin pink, veins flat and difficult to see. 21. What changes occurred when the subject emptied the forearm of the blood by raising the arm and making a fist, and the flow was blocked with the cough? Our answer is vein lost color and skin turned eye. Thank you. That will be all for my discussion on human cardiovascular physiology, blood pressure, and pulse determination. Now let's call on Ms. Gapasin to discuss the lymphatic system.
Now, I will be discussing the Part 5 lymphatic system. Part 1. Figure 6.1 shows the main structures of the lymphatic system. Label the structures indicated using the key choices listed. Here are the answers on its respective order. Number 1. Palatine tonsil. Number 2. Submandibular node. Number 3. Cervical nodes. 4. Right lymphatic duct. 5. Thoracic duct. 6. Cisterna chyli. 7. Intestinal node. 8. Intestinal node. 9. Popliteal node. 10. Lymphatic vessels of lower limb. 11. Thoracic duct. 12. Axillary lymph node. 13. Lymphatic vessels of upper limb. 15. Peyer's patches or lymph follicles of the small intestine. And lastly, iliac nodes. Number 2. On figure 6.1, color and label the spleen, red bone marrow of the right femur, and the thymus gland. Different colors using the key below. The spleen is located right under the chest, the dark green color. The thymus gland is located on the upper chest on the red color. And the red bone marrow is located at the leg part, at the femur, on a cyan color. Number 3. List the 3 main functions of the lymphatic system. The first function is to maintain body fluid. Second, transport white blood cells. Third, transports fatty acid from the digestive system. That's all. Thank you.
Good day everyone, I'm Tanya Garcia and I'm going to discuss the lymph and lymphatic system. Number 4, which important constituent of blood is absent from the lymph? Our answer is B, erythrocytes. 5. What is the difference between lymph and interstitial fluid? Our answer is lymph becomes interstitial fluid when it returns to the bloodstream. 6. Which nutrients is absorbed into the lymphatic vessels of the small intestine? Our answer is D, fats. Number 7. Which of the following does not contribute to the lymph flow? Our answer is contraction of adjacent skeletal muscles. 8. The thoracic duct empties lymph into the. Our answer is right lymphatic duct. 9. Which of the following lacks a network of lymphatic vessels? Our answer is brain and cornea. Number 10. The following paragraph describes lymphatic vessels. Complete it by scoring out the incorrect option in bold, leaving the correct option. The smallest lymphatic vessels are called ducts, venulus, capillaries. One significant difference between them and the smallest blood vessels is that they are only 1 cell thick, have permeable wall, originate in the tissue. Their function is to drain the lymph containing red blood cells, white blood cells, platelets, away from the interstitial spaces. Most tissue have network of these tiny vessels, but one notable exception is bone tissue, muscle tissue, fatty tissue. The individual tiny vessels join up to form large one, which now contain 2, 3, 4 layers of tissue in their walls. similar to veins in cardiovascular system. The inner lining, the endothelial fibrous muscular layer covers the bulb which filter the lymph, store the lymph, regulate flow of lymph as vessels progressively progressively unite and become wider and wider. Eventually, they empty into the biggest lymph vessels of all, the thoracic duct in the right lymphatic duct, subclavian duct in the right lymphatic duct, thoracic duct and subclavian duct. The first one of these drains the left side of the body, right side of body above the diaphragm, lower limbs and pelvic area. The second drains the upper body above the pelvis, right side of the body, lower part of the body, and the upper left side of the body. Our answer is capillaries, 1 cell thick, white blood cells, bone tissue, 3, endothelial, regulate flow of lymph, right lymphatic duct, left side of the body, and right side of the body. That would be all for lymph and lymphatic vessels. Now let's proceed to Miss Guinocor to discuss lymph organs and tissue.
Lymphatic organs and tissues. Labeling and coloring. For number 11, figure 6.2 shows the internal structure of a lymph node. Label the structures indicated and color the capsule and associated trabeculae. So as you can see in the picture, the labeled parts are the afferent vessel, afferent valve, capsule, subcapsular sinus, trabeculae, and the medullary sinus. The colored parts, as you can see, the green is indicating the capsule, while the blue one is indicating the trabeculae. For number 12, on figure 6.2, insert arrows to show which way lymph will flow through this lymph node. So you can see in the picture, the red arrows shows where or which way lymph will flow. So the lymph will enters the convex side through afferent lymphatic vessels. Lymph flows through a number of sinuses inside the node, and then lymph exits through afferent lymphatic vessels. Number 13. On average, lymph flows through how many lymph nodes before returning to the bloodstream? Our answer is at least one lymph node. For question number 14, what are the main types of tissues that make up a lymph node? Our answer is D, lymphatic vessels and connective tissue. Number 15, which important protective cells are found within lymph nodes? Our answer is lymphocytes and macrophages. A. Number 16, which of the following statements is true concerning the structure of a lymph node? Our answer is D. Each node has a concave surface called the hilum, where various vessels enter and leaves the node. Number 17, which is the main group of nodes draining the arm? Our answer is B, the axillary nodes. Number 18, define the term phagocytosis. Phagocytosis is a process by which certain living cells called phagocytes ingest or engulf other cells or particles. The phagocyte may be a free-living one-cell organism such as amoeba or one of the body cells such as the white blood cell.
The four types of particulate matter that are removed from the lymph are first, cancer cells, second, bacteria, third, cell debris, fourth, viruses. What happens to organic materials, phagocytodes in the lymph nodes? Our answer, the receptors on the surface of phagocytes bind to bacteria when they come into encounter with them. The bacteria will be engulfed by the phagocyte as a result of this binding. What happens to inorganic materials, phagocytodes in the lymph nodes? Our answer: certain inorganic inhaled particles are not destroyed by phagocytosis. These may either cause no harm or cause the macrophage cell to die. Under the spleen, our answers are as follows. First, stores blood. Second, red blood cells destroyed here. Third, lies immediately below the diaphragm. Fourth, largest lymphatic organ. Fifth, synthesizes red blood cells in the fetus. And lastly, it is bean-shaped. For the thymus, our answers are maximum weight, usually 30 to 40 grams, secretes the hormone thymosin, made up of two narrow lobes, at its maximum size at puberty, lies immediately behind the sternum, where T lymphocytes mature. Lastly, under the lymph node, our answers are: first, oval in shape, size from pinhead to almond sized. Third, filters lymph. Fourth, site of multiplication of activated lymphocytes. Fifth, distributed throughout lymphatic system. And lastly, phagocyzes cellular debris.
For number 23, figure 6.3 shows the main structure that lie around the thymus gland. Color and match the following. 24. Label the blood vessels on figure 6.3. Color the arteries in red and the veins in blue. Our answer is thyroid gland, trachea, right thymus, right lung, left intervalvular vein, left common carotid, left subclavian artery, left subclavian vein, right brachiocephalic vein, left thymus, left lung. And the red one is the arteries and the violet one is the veins. That will be all. Now let's proceed to deep dive.
I am Alteza Gonzaga and I'm going to teach you how to locate the pulse points of the temporal artery. In going to find the pulse points of the temporal artery, you need to use your first two or first three fingers. We are going to find the temporal artery. And to find this artery, you need to have your landmarks. So our landmarks are the tragus of the ear and the cheekbone. So the pulse site is right here. This is your temporal artery, and of course, you need to feel it bilaterally.
So, good day everyone. For number 2, I'm going to demonstrate on how to find the carotid pulse point or how to check your pulse over your carotid artery. Place your index finger and middle finger on your neck to the side of your windpipe. When you feel your pulse, look at your watch and count the number of beats in 15 seconds. Multiply this number by 4 to get your heart rate per minute. When you're done with that, you go to the other side and do the same thing.
Now we're going to find the apical force. First, position the patient by having them lay back. Find the landmark of the fifth intercostal face. Mid-clavicular line, it's going to be the left side. Find the sternum notch, which is right here between the clavicle, right here. Then so you go down slightly. As you go down, you're going to find the angle of Lewis, also called sternum angle. Then go to the left slightly. Then you're going to be in the second intercostal or ICS. Then feel the third ICS. Go a little bit more until fifth. Now, when you find it, You're just going to feel with your hand the pulsation.
Good day everyone, my name is Monica Guinocor and I will be demonstrating on how to find the brachial artery pulse point. So whenever you are assessing the pulse, you will be looking out of the few things. One thing will be the rate on how fast is it, along with the strength, and you will rating it on the scale of 0 to 3, where 0 pulse is absent, 1 plus pulse is weak, 2 plus pulse is normal, and 3 plus pulse is pounding. And also you will find the pulse rhythm if it is regular or irregular. And as you feel in the pulse, you will be feeling bilaterally to see if they are equal. Now let's find the pulse point in arm, which is the brachial artery, and this is the major artery found in the upper arm, and we will actually go and divide into the radial and ulnar artery. Now we use this pulse point for whenever we are assessing the blood pressure and during CPR in an infant. We will check this side. And to check this side, you have to make the patient extend their arm and turn their arm out where their palms are facing upward. To find this artery, you have to find the area of the cubital fossa, which is this triangular area in front of the elbow, and the brachial artery is found at the top of this cubital fossa in this location right here. That would be all. Thank you.
Here's how to locate the radial pulse. First is to take out your two fingers, the index and the middle finger. Second, make sure that the hand that will be used to locate the pulse is in a relaxed placement. Third, put the two fingers on the base of the thumb and press lightly. Here is the base of the thumb. Observe that the thumb and the pulse are aligned. You're gonna place it here, this side, and press lightly. Then, you will feel the pulse faintly.
My name is Elijah Amira Fronteras. I'm gonna demonstrate how to find the palpebral pulse. To find this pulse point, you're gonna flex the knee. You're gonna take both your hands, put them behind the knee, and you will find it about
Hi, I am Japay. Allow me to demonstrate the location of the pulse point of dorsalis pedis. The dorsalis pedis artery or dorsal artery of the foot is a blood vessel of the lower limb that carries oxygenated blood to the dorsal surface of the foot. It arises at the anterior aspect of the ankle joint and is a continuation of the anterior tibial artery. In order to locate it, find the EHL tendon. If you extend your big toe, you will see your tendon right in here. If you follow this tendon and go a little bit at this point, it will be the location of your dorsalis pedis.
Good day everyone! Today I'm going to demonstrate how to find posterior tibial pulse. But before that, let's remember a few things. First, the rate, how fast it is along with the strength, and you will be grading it. 0 being absent, 1 plus being weak, 2 plus being normal, 3 plus being bounded. Now we're going to find the posterior tibial. Posterior tibial can be on the inside of the ankle, found between back of the medial malleolus is the bony prominence of the ankle bone, Achilles bone, and we can find it within this area.